So look at the screen. The first question is a 40-year-old man present with daytime sleepiness. So first hint in the MCQ is daytime sleepiness and impaired concentration. Now, this is like a feature you can see now when it's the option in INI-CET paper, you can see all options are pretty much close. So then you can notice BMI is 41. So this is the biggest hint. BMI is 41 and BP is 160/100. ABG analysis. Second hint in the MCQ which they are giving you is PSCO2 is 50. So understand this, whenever you see a person who is having BMI more than 30, BMI more than 30, and if you see like patient is having a daytime sleepiness, he is sleepy in the day. So this is not a case, I can say it's not a case of obstructive sleep apnea. For obstructive sleep apnea, what we need AHI index, apnea hypopnea index, right? This is not narcolepsy because here there is mentioned a few more things, added things other than narcolepsy. You can see patients having daytime sleepiness, there is a high BMI. So this is a classical feature which we have discussed in our video lecture, that is obesity hypoventilation syndrome. It is a case of obesity hypoventilation syndrome. So this is something which you should remember. Central sleep apnea, you will see this is because of FOX2B gene mutation. So this is the first question. Many of you marked the answer OSA, but remember this is not OSA. It is obesity hypoventilation syndrome. Coming to the next question. So this was the pattern. So you can see here, this was the pattern game. What is the pattern on immunofluorescence? So if you see this image, this pattern is what we call the centromere pattern. And this centromere pattern we see in a patient with CREST syndrome. This is seen in a patient with CREST syndrome. Now, what is CREST syndrome? It is calcinosis, Raynaud phenomena, esophageal dysmotility, sclerodactyly, and telangiectasia. So this was like straightforward question which came again from the notes. You can see CREST syndrome CREST syndrome will have anti-centromere antibody. We call it centromere pattern. Okay, coming to a third MCQ, that is massive blood transfusion. Complication include all except. So just try to understand this. Whenever we are giving blood to a patient, so what's happening? Blood, or we are giving whole blood or PRBC. So this blood which is in the bag, that blood is having citrate. So this blood is having citrate, and remember this citrate is having a feature. This citrate will chelate calcium. So citrate will chelate calcium. So you will see like patient will develop, because of this citrate, you will see patient can develop hypocalcemia. So calcium will be decreased, and the citrate can also chelate magnesium. So there will be hypomagnesemia, right? Now understand, it will lead to hypocalcemia. Hypocalcemia is seen, hypomagnesemia is seen. Now when you see whole blood or PRBC, this blood is coming from a refrigerator. This blood is chilled blood. That chilled blood can cause hypothermia also. So understand this, due to massive blood transfusion, you will see hyperkalemia, not hypokalemia. So answer for this question will be hypokalemia. So again, this was a question from the notes. You can see hypocalcemia, you can see hyperkalemia, and this hyperkalemia later on can cause a cardiac arrest. And even like there are many other complications like we have discussed, like TRALI and TACO, that is transfusion related acute lung injury and transfusion associated cardiac overload, that or circulatory overload, we call it TACO. Coming to next MCQ, treatment of choice in Kawasaki disease. So you can see here straightforward question, IVIG, intravenous immunoglobulin, right? So this is we give by infusion. That is the treatment of choice. So it was a case given with some of the photographs. Some students are saying it was given like strawberry tongue was given. Some are mentioning it was given like this erythema was mentioned. And some students had multiple pictures was given. So whatever the picture is, it was asked treatment of Kawasaki, you know, anti-endothelial antibody we find in Kawasaki. So treatment of choice will be IV immunoglobulin. Yeah. So this is about some easy questions. Now moving to a little forward, I can say more advanced type of questions. So most of the paper, if I give my verdict on this paper, this will be like a paper where a pharmacology was asked in relation with medicine, pathology was asked in relation to medicine, microbiology was asked with medicine. So this was like a mixed bag paper where you are seeing a lot of clinical questions. So a lady was taking an oral. So first hint the MCQ is oral. So when I see this word oral, then liraglutide is ruled out because it is subcutaneous. When I say the word oral, pramlintide is ruled out because this is also subcutaneous. Metformin is oral, gliptins are oral. So let's see these two. Sure. Which reduce HbA1c from 7.6 to 6.7. GLP-1 level, glucosamine peptide 1, are high. So understand this high GLP-1 level you can see with two drugs. So first is it can occur because of DPP-4 inhibitor. Second is this can occur because of GLP analog. And GLP analog, remember, these GLP analog, how we give? GLP analog, mostly they are given by subcutaneous route. Only one, that is semaglutide, is orally available. It is even approved only in a few countries. So, and that was not in the option. So again, so this is like we can easily see this option. Sitagliptin, some people are saying it was like allogliptin was given, some are saying vildagliptin, but whatever it is, gliptin is the answer. Is it clear? So this is about a question where diabetes was asked in detail. Coming to next question, it was a match the following question. So again, you can see first when you see mesothelioma. So let's try to understand this. Mesothelioma is a tumor of pleura. So how this will present? This will present with pleural fluid. So person will have more pleural fluid. More pleural fluid means pleural effusion. So mesothelioma, this will present with pleural effusion. Now, let's see asbestosis. Asbestosis, you see this is like in cement workers, in shipyard industries, sometimes even in textile industries. So, this asbestosis will affect base of the lung, right? Asbestosis will affect a base of the lung. So, this will involve lower lobe. Okay, this is an pulmonary alveolar proteinosis. So, again, a pediatric condition. So, now let's see Kaplan syndrome. Kaplan syndrome is nothing, it is a co-worker pneumoconiosis, right, with rheumatoid arthritis. So, co-worker pneumoconiosis with rheumatoid arthritis, this is Kaplan syndrome. Now, see, by rule out, you can mark the answer. That is called a crazy pavement pattern. This crazy pavement pattern you can see in many diseases. It is like a non-specific CT finding which we see in many diseases. So, this is the real match. You can see this question came in exam and many of you, I think, marked the answer correct. So, let us see what we have discussed in the class. You can see crazy pavement or crazy pavement pattern you can also see in silicosis. Then asbestosis, you can see asbestosis is associated with mesothelioma and this will present with pleural effusion. Coming to next thing, you can see co-worker pneumoconiosis with rheumatoid arthritis. What we call this Kaplan syndrome, and if it is with the neutropenia splenomegaly, that's what we call this Felty syndrome. Then if you see this is like a lower part is involved, right? Lower lobe is involved in asbestosis. Okay, so this was a question where even community medicine was overlapped with medicine. Now see, adult with a dog bite, present with wound in thigh. So first hint in the MCQ is dog bite. History of splenectomy. So this is another hint. Means a patient having splenectomy, you know, like a patient who have splenectomy, they are at risk of developing infection with capsulated microbes, right? So any person who had spleen removal due to any reason, so they can develop infection with streptococcus, they can develop infection with Neisseria, they can develop infection with Haemophilus. So now understand, both dog and patient are fully immunized. What is the management? So this person who is at risk of infection with streptococcus, with Haemophilus, with Neisseria, so these persons should definitely receive antibiotic, otherwise they are having a huge chance of developing superinfection, right? So which antibiotic you will use? We will use amoxicillin. So this is again a question which came directly from the Harrison chart. So amoxicillin is given to patient, right? So this is like a straightforward question. So observation is not the answer, not metronidazole, not ciprofloxacin. Now let's see the next question, again a clinical case. So this is like most of you have done correct. I could not get other two options. So let's see severe RT, road traffic accident, right femur shaft fracture. Initially normal, after 12 hours, rash over axilla and chest. Vitals are unstable. So like some students are telling some vitals was given, so that was generally unstable. So in that case, what it is? It is not a chest trauma, it's a case of fat embolism. It is a case of fat embolism. Okay, then you can see next MCQs, aortic regurgitation murmur. So aortic regurgitation murmur, this is a murmur that is a diastolic murmur. So we see this in ventricular diastole. Most common cause of hypercoagulable state. So this was the question which student told us. So let me just try to make it even more correct. So I think that this could have mentioned most common inherited cause. So that should be the line. Most common inherited cause. So when we see most common inherited cause, this is a factor 5 lead-in mutation, right? Most common overall cause, what we see, you can see hypercoagulable state can occur due to uremia, it can occur because of antiphospholipid antibody syndrome, but inherited cause, that is factor 5 lead-in mutation. Okay, then again, diabetes was asked in the treatment part. Let's see the question. Patient started an anti-diabetic drug 5 months back. HbA1c reduced. That's a good thing, means drug is working in the body. Patient complaint of intense vulval pruritus. Vulval pruritus, so you can see it means patient is having urogenital infection. So which drug predispose the risk of UTI cystitis? That is SGLT2 inhibitor. SGLT2 inhibitors, and that is canagliflozin. Canagliflozin, simple. So again, a question which was asked from the conceptual thing, canagliflozin, this is SGLT2 inhibitor, right? And these are, remember, these are few side effects, otherwise all are good advantage of these drugs. So they will prevent CKD progression, they will prevent heart failure. So nowadays even we use this drug in treatment of patients with heart failure who are not having diabetes. So they are approved even in non-diabetic patients with heart failure. Auscultation point superior to inferior on left side. Auscultation point superior to inferior on left side. So what are these auscultation points? So remember, all people enjoy Time magazine. Aortic, pulmonary. Let me make it more clear. So this is a question that came straight away. Aortic, pulmonary. Then what we have? We have Orb's area, tricuspid, mitral. So if Orb's area, if I remove this Orb's area, then you can see PTM, that is pulmonary, tricuspid, mitral will be the sequence. PTM. So 1, 2, 3 will be the answer. Right. So again, this was a question student gave us, but there may be some twist with the question. If you see like some more details, it's a recall based question, then you can ask that thing in the comment box. We'll try to improve this. But if it is just given, then that is the answer. Okay, so this was a new question, fresh question came in exam about subclinical myocarditis. So let's try to understand this. What is subclinical myocarditis? Subclinical myocarditis means patient will not have symptom. So there will be no symptom. Subclinical meaning is no symptom, right? Simple. Subclinical hepatitis C means no symptom. So no symptom. But you will see in this type of myocarditis, you will see ECG will have some changes, and this will be non-specific ECG changes. So ECG changes are present. Then if you see in these echocardiography, you will also see some changes. So just try to understand this. ECG will have some changes. 2D echo. In 2D echo, you will see either I can say right ventricular wall abnormalities, right? So that is a regional wall, we call this regional wall abnormalities, you can see. 2D echo will also have some changes. Then remember, even markers of either heart failure or markers of infarction will be positive, means either NT-proBNP will be positive, troponin will be positive. So cardiac markers are positive. So everything is positive, means patient will not have symptoms. That is called subclinical. So let's see the question now. Elevated proBNP, so these are the markers. This is a true statement. Palpitation is seen? No. Palpitation means there is no symptom, means there should not be palpitation. If it is present, it means that is not subclinical, that will be clinical, right? Low left ventricular ejection fraction on 2D echo. So in 2D echo, you will see some findings. So 2D echo, if you do color Doppler, what you will get? You will get a low ejection fraction, and what else you will get? You will get like a regional wall abnormalities. So regional wall abnormalities present. So these two are correct statement. So echo findings are positive, ECG changes are present. So these are correct. So this is a multiple choice question. Question was true statement. So answer will be B, C, D, E. So in this we have 4 options, B, C, D. These are 4 correct statements. Only first is not the answer, right? Okay, moving to next. Virus caused slapped cheek appearance. So you all got the hint. Microbiology again coming with medicine. That is parvovirus B19, right? This parvovirus B19. If you see this parvovirus B19, this is also having tendency to damage hematopoietic stem cells. So this can damage hematopoietic stem cells, especially those stem cells which produce RBCs. So that is, it can lead to pure red cell aplasia. A second thing is this can also cause a plastic crisis in a patient with sickle cell anemia, right? So again, straight away question. This was the expected question and came from our notes. That is pure red cell aplasia. Coming to next, what we have. New drug approved for Rett syndrome. So, like Rett syndrome is a form of autism. So, where we see microcephaly, small skull, low IQ. It is an X-linked dominant disease. And that's why this is more common in girls. So, you can see patient will have mental retardation because it's a form of autism. There will be microcephaly. So, previously we were not having enough treatment for this, but now this is like torafenitide is a new drug that is approved for treatment of Rett syndrome. Clear? Okay, now moving to another microbiology overlap with medicine. History of man with renal transplant. So this is the hint. It is the hint again. This is when you see like in horizon we have a separate section of infectious disease. So this is a topic, a question came from that part. Many medications, right? So history of man with kidney transplant, so he's using many medication because maybe like he's taking some immunosuppressant drugs. Later medication, his hand was red, later spread onto his whole hand. Mason Fontana stain was positive, fungal organism was asked. So this was like a question given by students. So this is what is the fungus? So this, remember, in immunocompromised patient or an HIV positive patient, or I can say in person who are a transplant recipient or person on any immunosuppressant drug, they are predisposed to get infection with Telleromyces marnifi. Telleromyces marnifi. Coming to next one. Now let's see again a dangerous microbiology question. Critical care specialist has grown organism in different culture and observe resistant to carbapenem, fluoroquinolone, aminoglycoside. So these 3 are resistant, right? Now understand this. In Pseudomonas, we can see sometimes resistant with some fluoroquinolone, aminoglycoside, but they show some sensitivity with carbapenem. So that is not the answer. Now coming to other 3 options. If you see Acinetobacter baumannii and Stenotrophomonas, these are multi-resistant bugs. So, but you can see there is like some susceptibility to ticarcillin and clavulinate that we see in a patient with Stenotrophomonas maltophilia infection, right? Even like Acinetobacter baumannii will also have similar presentation, but seeing this in the option ticarcillin and clavulinic acid, we can choose the answer Stenotrophomonas maltophilia. Okay, then again this was a multiple choice, multiple correct answers was asked. So let us see the question first. A patient with acute watery diarrhea. So when we see watery diarrhea, water electrolyte abnormality, we think of WADA syndrome. Just for an extra information, I am telling you, like watery diarrhea we can also see in watery diarrhea, hypokalemia and achloridria. Hypokalemia and achloridria. Watery diarrhea, hypokalemia, achloridria. This is what we call this WADA syndrome or pancreatic cholera, or one more name, WADA syndrome, pancreatic cholera, what else? VIPoma. Right? Now understand this, but here it was not asked. So watery diarrhea and vomiting was hypotensive and unresponsive. With the given finding, what is the diagnosis? Now understand this. Suppose you are having a diarrhea, loose stool. So when you are having a diarrhea, severe massive diarrhea or vomiting, this will lead to hyponatremia. It will lead to decrease in sodium, and decrease in sodium will further lead to decrease in BP. So this is a possible answer, right? So this is a correct statement, right? Now coming to a cerebral venous thrombosis. There is a thrombosis in the vein, cerebral vein. So that is the cerebral venous thrombosis. This can produce this can produce either a cerebral salt wasting syndrome or it can produce SIADH. So again, this SIADH or cerebral salt wasting syndrome, that can cause hyponatremia, right? And because of hyponatremia, patient will become hypotensive. So this could be the answer. Hemolytic uremic syndrome, here you will see most of the uremic finding, means most of the kidney findings, right? And severe dehydration, definitely severe dehydration will cause hyponatremia, and that can again cause the same thing. So in my opinion, the correct answer for this will be option A, option C, and option D. So this is again a multiple choice, right? So these three could be the causes of watery diarrhea in the patient. Okay, now coming to a straightforward easy question which came in exam, like a person who is having breast cancer with HER2/neu positivity. So HER2/neu positive, generally what we give trastuzumab, but if it is resistant to trastuzumab, the next drug is lapatinib. So sorafenib, we know this is we give for HCC. Then we have emorafenib, we give this for treating melanoma. So this lapatinib was the answer, straightforward question. Okay, again this was like again question from the notes that was straightforward stroke patient. So you can see, I think in exam the clock was given, right? So it was like 50-year-old male present with weakness in the left side of body. Patient was asked to redraw and he was only able to draw the right half of the handwritten image. He could draw from clock hour 6 to 12. It was suggestive of left hemianopia. It was asked that what could be the possible site. So when you see left hemianopia, this is like a lesion in the right parietal cortex. But in the option, it was given parieto-occipital. So some are saying like it was given parieto-frontal. So right parietal is the answer. Okay, so this was the question which I need your help to type in the comment box. It was given like a man present with smell of alcohol. Alcohol smell. And congestion in the eye. He is able to walk in a straight line, right? So he can walk in a straight line, right? He can walk in a straight line. He is not confused. So if you see this question, what I can see in this question is this is a person who developed tolerance to alcohol. So there are people who drink daily. When they drink a lot, they develop tolerance, means they will not get effect of alcohol even on higher doses. So this is like this person have taken alcohol, but is not under its influence. Is alcohol, or suppose he has consumed alcohol, that is the true statement, because he is having smell of alcohol. He has taken alcohol and is under influence, no. Right? He is not confused, he can walk in the, so he is not under the alcohol influence. So these two statements are true. I could not get the fourth option if you could get, but remember these two are true. Is it clear? So this person have consumed alcohol, but he is a regular drinker, and because of that he have developed tolerance. Okay, then straightforward question. You can see cause of high output cardiac failure. So remember beriberi anemia, even system AV shunting, then we have thyrotoxicosis. So these are the conditions where you will see like hyperdynamic circulation. In these you will see high output cardiac failure. A core pulmonale, which we call right side heart failure, that's a case of a low cardiac output heart failure. Is it clear? So answer straightforward. Core pulmonale is not a cause of high output cardiac failure. Iron profile in iron deficiency anemia. So first thing what we see, first thing we will see in iron deficiency anemia is decrease in ferritin. Right? Then ferritin means store form of iron. So this is a correct statement. This is a correct statement. Ferritin is decreased. Then you will see there will be decrease in serum iron. This is also a true statement. Now you will see transferrin saturation is also decreased, and ferritin is decreased, so TIBC will increase. So you can see all these statements are correct. What else they can ask you later or in future is like what else is increased? So remember free erythroprotoporphyrin, FEP, and red cell distribution width. These three parameters are the one which are increased. Total iron binding capacity, free erythroprotoporphyrin, and red cell distribution width. So here all statements are correct. So answer will be 1, 2, 3, 4. I hope it's clear. All are correct statement. Okay, coming to next Straightforward question. Amyloid deposition after hemodialysis. So which is the amyloid? That is A beta 2M. This is A beta 2M. Some of you have marked the answer A beta. I know A beta is seen in Alzheimer's disease. Right? This is amyloid is after dialysis. That is A beta 2M. Okay, then there was a question on like which is more specific for alcoholics. So remember, this is SAST, S for Sharab. So Sharab specific is AST. So even GGT is given, GGT is not specific. So remember the best answer, I don't know the exact question, but students are saying like if this ratio is given, so AST, ALT ratio is more correct than AST. GGT, remember, it is no longer considered specific marker for alcohol-induced liver damage. Is it clear? If ratio is given, that is the more correct answer. So AST, ALT value. Remember this AST, ALT value. If this ratio is more than 2:1, then this is suggestive of alcohol. If this ratio is more than 3:1, means AST is increased. Both are increased, AST is increased more. Ratio is more than 3:1. This is definitive of alcohol. And if this ratio is more than 5:1, mark some sharab pita. This is a case of alcohol. Clear? So 2:1, suggestive, 3:1, definitive, 5:1, almost diagnosis of alcohol liver disease. Then there was a question, like it was a false statement asked about a blood product and the storing temperature. So I think this was the question, but I could not get the question, exact question. So you can rectify this question from this chart, which we have discussed in our app. So storage temperature for whole blood PRBC, this is like 2 to 6 degree or on an average 4 degree. That's a normal fridge temperature. SDP, RDP, we store in normal room temperature with AC on 18 to 24, not like Indian summer temperature. And FFP carbohydrate, we store them in minus 18 degree. So this was a type of question which came in exam. Okay, so this like when I have seen this question, I was very glad because same thing I told in the class, like a mother while kissing the child finds the sweat of child appear to be salty. This is salty baby syndrome. CFTR gene, cystic fibrosis, chromosome number 7, right? So this is a chloride channel defect. So straightforward question, chloride channel defect, cystic fibrosis. History of vomiting came to emergency department. What can be seen? So prolonged vomiting, what it can cause? Vomiting means there is a loss of electrolyte. There will be loss of H positive ion. When you see loss of H positive ion, there will be metabolic alkalosis. Metabolic alkalosis. Okay, then this was a question. A 22-year-old woman comes to OPD with palpitation. So she is having palpitation, means she is having some sort of arrhythmia. Later on, she develops syncope and become hypotensive. So maybe like she came up with another arrhythmia, then she precipitated another type of arrhythmia. Then ECG was given. So when you look at the ECG, you can see like a wide QRS. When you see a wide QRS, then this AF cannot be the answer. AF cannot be the answer, right? And if you see here, there are more than 3 different. You can see irregular RR, and you can see more than 3 different type of QRS. So you can see a broad QRS that is suggestive of torsades de pointes. We call this a ribboning pattern. So more than 3. So you can see one QRS like this. Then you can see 3 different type of QRS. So this is a case of torsades de pointes. And how you'll manage this is managed by MGSO4. So this is torsades de pointes. You'll see broad QRS, irregular RS, and more than 3 type of QRS. Then this was a question came in exam like which are reversible. So understand this, which is not a reversible was asked. So hypothyroidism. So if you give thyroid supplementation, this will be corrected. So this is reversible. Normal pressure hydrocephalus. So this is also reversible when you do shunting procedure. So this is also reversible. And vitamin deficiency, any vitamin like B1, B12, or these vitamins, if you supplement them, so then that will be reversible. So all the neurodegenerative disease. So remember, it is all like Alzheimer, Parkinson disease, Huntington, Creutzfeldt-Jakob. Now what is Lewy body? Lewy body dementia is a type of Parkinson plus syndrome, right? So understand this. In neurodegenerative disease, you will see irreversible dementia. Clear? This is irreversible. Okay, then this was a question. What is the mechanism of action of plasma exchange in thrombotic thrombocytopenic purpura? So understand this. This TTP is a condition which is due to Adam TS13 mutation. Adam TS13 mutation. So what happened? There is antibody production against this. So because of this, like this is we need this for so that a war Brunn factor could be cleaved into pieces and it can act. If this is mutated, if we have antibodies against this, then von Brunn factor will not work, right? When von Brunn factor is not working, it means there will be defective hemostasis, or it's basically what we call this primary hemostasis. So understand this: TTP, thrombotic thrombocytopenic purpura. If you change the plasma, because here we have antibody against this. So if you change the plasma exchange, this will remove this antibody. So the answer was removal of antibody, and this will try to replenish the source of Adam TS13. So this was the answer. Remove antibody and replenish normal Adam TS13. Easy one. Anion gap. Sodium plus potassium is cation minus anion. So just make a calculation like it is 145 plus 4. Sodium plus potassium minus 90 plus 20. So this is 149 minus 110. So this will come how much? 39. Right? 39. So this is the answer. Like some students are saying 39 was not given, 35 was given. If 35 was given, then you should not add a potassium value. Then you should just subtract this from 145. So this is how we calculate anion gap. So normally what we take sodium value, but a true anion gap we calculate by using both values, sodium and potassium. Okay, so this was like a bit good, I can say a difficult type of question. A 35-year-old man is evaluated for severe breathlessness. His febrile SpO2 is 87. SpO2 is 87, right? Means this is SpO2, whenever you see it's less than 90, means that's dangerous. On 6 liter oxygen, now it is dangerous, right? With a nasal cannula, it's not on room temperature, it's even more dangerous. Orientation to person only, means not oriented to time and place. TLC is 19,000. Serum creatinine is 1.4. Sputum shows 2++, 1 plus epithelial cells, rhinovirus detected. What will be administered? So basically you can see when you see this, it's like it's looking like a case of a severe pneumonia. So provisional diagnosis which I can make with this is severe pneumonia. How you will treat this? Now try to understand this. In this pneumonia, now there is a risk of infection. So basically how you will see this patient. This patient is the candidate of ICU admission. So only azithromycin is not sufficient. So here we have to use strong IV drugs. Now if I say ceftriaxone, we will not use because TLC is already 19,000. Right? We can use this whenever there is like it is a little less severe. So if you see like all these three options are pretty much close. So generally like what Harrison says, let me show you the slides first, what it is. So what it is generally showing. So you can notice, just a moment. So generally what they ask in exam is, we admit the patient on ICU. So whenever we are admitting the patient on ICU, what we start with a drugs which is having a broad spectrum action. So ceftriaxone nowadays we use less because of resistance against microbes, and this is not the answer. So if I say azithromycin alone is not used in ICU setting, now we have two options: ceftazidime plus azithromycin, or piperacillin tazobactam plus ciprofloxacin. So what Harrison says is like in ICU admitted candidate, what we prefer to use a piperacillin tazobactam or meropenem, and along with this we add a respiratory fluoroquinolone or azithromycin. Means this is ciprofloxacin, means that is a respiratory fluoroquinolones, or we can add azithromycin. So if you see by this history, what I can say, this is the most correct answer, right? Again, you can give some of your input so that we can make it more better. Coming to next question, which of the following does not qualify as severe COVID? So when you see severe COVID means we defined severe COVID as Any person who is having respiratory rate more than 30, means there is respiratory rate more than 30, that is called severe COVID. Here it is given 32, that is severe. SpO2, when our saturation pressure is less than 90, when it is less than 90. So it is given 87, again this is severe. HRCT involvement, so understand this, HRCT involvement means if it is like 50% of or more involvement of both lobe, or 40% or more involvement of a single lobe. So that is the definition. So here it is given 42. So again that is a severe COVID. Lobe is not mentioned. So then you can see map of 70. So mean arterial pressure of 70 is considered normal, and even like when you see the guidelines, we categorize COVID based on symptoms, based on respiratory rate, based on GCS, based on patient status, based on SpO2, based on CT finding, not based on map. So this is not like map of 70 is normal. This is the answer. Is it clear? It is not a criteria. Okay, then there was a question. It was like one of the easy questions in hematology. It was mentioned smudge cells are present. What is the best test? So best test is flow cytometry. A case was given for a 58-year-old. So it was like a case was given, and this was a case of a 58-year-old male with lymphadenopathy was mentioned, and it was mentioned like smudge cells are present. Smudge cells, I told you where smudge cells in CLL, and in this, what is the investigation of choice? So this was the question came. So investigation of choice in this case is flow cytometry. Flow cytometry. Clear? So this is the answer. Flow cytometry. So this is about the discussion of some of the recall topics. If you knowing a few more things, you can add in your comment box so that we can give you a more detail. And if you get some wrong here, just don't panic. NEET PG is done, INI-CET is done. It's time to enjoy. So just enjoy now, relax. Then let's see what's next. Because then there's no point of disturbing yourself. So just for your review, that's it. Just don't take this seriously, right? Just think it's a joke. So just remember, you can, you will. Enjoy yourself. Go to Manali, go to Shimla, go to some place, enjoy the weather, and then you can, when you come back, you will be having your result and a good seat, a good clinical seat, or a good non-clinical seat in a good college is waiting for you. Remember, you can, you will. Bye-bye.